listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I am your pharmacist, Paul White. Glad you joined us. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass and Genuine Appraisals and Liquidations, and they are having a tag sale this weekend. Today, Brad and I are broadcasting from our administrative offices, and our very special guest is Dr. Mandy Pullekins, veterinarian with For Paws Animal Hospital. Good morning, Dr. Pullekins, and welcome to the show.
Good morning. Thank you for having me.
Okay, well, if you're listening to this show, you're probably a pet owner, and in the United States, 70% of us are pet owners, up from 56% in 1988. You may have heard that pet adoption spiked during the pandemic, and the statistics show that this was true, but primarily among households who already had at least one pet. More of us are dog owners than cat lovers, except for me, and the average annual spending on a pet dog is about $1,200, with a little over $400 of that going to food. We spend significantly less on our cats, another reason why I like cats, for an average annual spend of $687, with $329 on that for food. Regardless of the stats, our pets are members of our family. Our spending concern and devotion to our pets is a reflection of that bond. So this morning we're going to talk with Dr. Pullekins about showing our pets some love and learning tips to keep them happy and healthy. We'd like to remind our listeners that this program will be available later on our podcast. You can download it from the App Store and your favorite podcast app. Just look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime.
So, Dr. Pullekins, again, welcome to the show. Please tell your listeners a little bit about yourself and your practice.
Okay, so I graduated from The Ohio State University.
Oh, The Ohio State, okay.
I had to keep the D.
Okay.
I did my undergrad there, and I did my vet school there as well. So I'm an 8-year Buckeye.
Wow.
Yeah. And I've been practicing at For Paws for about 10 years now.
Yeah.
And our practice primarily does kind of your wellness, preventive medicine, vaccines. We see sick patients, so anything from tummy troubles to ear and skin issues. And then I also am primarily the veterinarian responsible for surgery. So I do most of the spays, neuters, mass removals, and then, your dog ate a sock, I get to take that out kind of thing.
Does that happen very often?
Yes, actually. I actually just took a couple socks out of a dog's stomach the other day. So yeah, a matching pair. So we were happy to get both back.
Okay.
So yeah,
Okay.
It's fun. You never know what's walking through the door.
Okay. All right. Many of us recently celebrated Easter. I know chocolate isn't good for dogs, but what are some safe treats for our pets? And what would we do if the dog gets a hold of an Easter basket on all the goodies?
Okay, so safe treats. I mean, it's always best to talk to your vet, and you'll probably hear me saying that over and over and over again today. But so it's always best to talk to your vet if you're worried about treats, if your dog got your Easter basket, because sometimes that's not a huge deal. Big dogs can handle a little bit more chocolate than a small dog. So it's always best to talk to them and decide if it is something that warrants an emergency treatment versus just kind of monitoring at home. But safe treats, I like to go healthy because we do have an issue with obesity and a lot of animals being overweight. So I like to do carrots are lovely. Dogs love it. They love that crunchy. Celery is really, really good. My dogs love celery, which is super low in calorie, and it's got that nice crunch to it. So you can do apples. Green beans are awesome. I like to add green beans a lot to like meals when we're cutting food for diets for dogs because they're low in calorie and they kind of bulk up that diet and they make them feel full. So those are really nice, healthy treats. Clearly, you're staying away from chocolate. Chocolate's not good. Staying away from grapes are absolutely terrible for dogs and their counterpart raisins. They're really, really bad. And I think that's something that a lot of people don't know, but it's really, really dangerous for them. So yeah, we got to stay away from those things. And same with cats. Not that most cats aren't going to get your chocolate and your grapes and your raisins and stuff, but sometimes you have the rogue kitty that wants to eat it. So you kind of have to stay away.
So what's with the chocolate? I mean, why chocolate is bad?
Well, caffeine is bad for them. So if you, on the same line, don't let them get into your coffee or anything.
Yeah.
But there's also a theobromine in it, and those can both cause, so those can both cause toxicities for dogs. And it's all kind of dose decided, or, dose is the main culprit. So, I mean, a little bit of chocolate, not so bad. A lot of chocolate is going to cause signs like a nervousness kind of thing. It'll cause their heart to beat really, really fast. It'll cause vomiting, diarrhea, can lead to seizures, and can be fatal if they get enough. And there's also a grade of chocolate too. So your white chocolate doesn't have as much of either of those substances in it as your milk chocolate does. And then you starting getting into the cocoa and dark chocolates, really where we see problems.
So is sugar a big issue then with the pets?
Not so much. It's not so much the sugar. It's more the substances in the chocolate that's the problem. So like the other day, my dog decided to get a bunch of jelly beans, and besides losing out on all my jelly beans, I wasn't too concerned with his health. He just had a nice treat. So yeah, sugar's not so bad for them.
Okay.
Yeah.
Okay. All right. Interesting.
So yeah, even vets have dogs that get into things.
Okay. You don't guard, hey? No guarding here.
I try.
What a hoot. Okay. All right.
So thinking about other things that might fall from the dinner table, what are some other no-nos that you shouldn't be shoving under the table that you don't want to, if the kids don't want to eat it, what should they not be feeding your pets?
Okay, so grapes, raisins are my big ones. I'm going to say that 100 times. Grapes and raisins. Call your vet immediately if your dog ingests that, or your cat. So I try to stay away from anything high fat, and that has nothing to do with weight or anything. Dogs are prone to pancreatitis, and high fatty meals can cause pancreatitis, which is basically just inflammation of the pancreas, and it makes them feel really sick, and can be really, really dangerous if they have it. So I try not to give them bacon or just anything made with a lot of oils, butters, that kind of thing. Onions and garlic. So if you really like to put onions and garlic into your meals, try to stay away from giving that to your pets, because that can be really dangerous for them as well. So those are my biggest ones. Other than that, if you sneak a piece of chicken, if you sneak some vegetables, if, my kids don't like broccoli, if they throw some broccoli to the pets, not so big a deal. That's
I used to go to my aunt's house when I was a kid, okay? And my aunt always had a huge plate of fresh tomatoes on the table, and you had to eat everything on her table or you didn't get up from the table, okay?
Oh, gosh.
So
that would have been rough.
I happened to drop one of the fresh tomatoes on the floor one day. Up comes the Cocker Spaniel and chews that baby right up, okay? Mm-hmm. So that's where I put my
so you learned a nice trick there.
My fresh tomatoes, because I didn't have to eat any. talking to my cousin several years ago, and I told her this story. She says, "You know what, Paul? I did the same thing."
Oh gosh, that dog loves tomatoes then.
Luckily,
those are fine. Tomatoes are totally fine.
Anyway, go ahead, Brad.
Well, we better take our first break. It's 1:15, and then we can talk about treatment.
Sounds good.
Okay, time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
Are you ready for a change? Transfer your prescriptions to the Medicine Center Pharmacy. Hi, this is Paul White from the Medicine Center Pharmacies. Are you looking for the personal touch from your pharmacist and pharmacy staff? Do you need home delivery or custom packaging to simplify a complex medication schedule? Look no further than the Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia. Bring in your prescription bottles, and we can transfer your prescriptions to the Medicine Center today, where wellness begins. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer, You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need sea glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
Hi, Paul White from the Medicine Center Pharmacy. If you haven't gotten your COVID vaccine shot yet, you've got to get to the Medicine Center Pharmacies in Canton, Louisville, Minerva, or New Philadelphia. We are waiting for you and have vaccine. Call or stop in your closest Medicine Center Pharmacy, and we'll take care of you. Getting a COVID vaccine will save you from getting very sick. So hurry and get on with protecting yourself. The Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Okay, welcome back to Health Matters with the Medicine Center Pharmacy. Did you know we offer free prescription delivery? Call your Medicine Center Pharmacy to learn about our prescription delivery program.
All right. I used to think that we were the only ones that made treats in our compounding pharmacy, but I'm finding out that a new trend for pet owners is to make treats in their home. So, Dr. Pullekins, can you tell us about what concerns you might have with someone whipping up homemade treats in their kitchen?
So I actually don't have many concerns with that. I think it's a fun thing to do. Get your kids involved. It's a fun thing to do. The biggest thing is you're going to avoid those toxins. So we're going to avoid grapes, raisins, chocolate, caffeine. Not that you're putting coffee into any of your dog's treats, but you probably shouldn't. So you're going to avoid those things. And we did I didn't mention sugar-free is actually really bad. So when you're starting to get in, xylitol is really, really dangerous for pets. It causes low blood sugar, which can be very dangerous and fatal, and it can cause liver toxicity. So never add any alternatives to sugar in there. If you're gonna go for it, use real sugar. But so sugar-free gum and stuff like that's really dangerous too. So yeah, there are lots online. If you look, there are lots of different ways to make dog treats, dog muffins, that kind of fun stuff. Usually using apples, bananas, that kind of stuff. So yeah, go for it. I think it's fun. I think it's really nice for the dogs and something you can do and get everybody involved in. So.
Super. Well, what if you want to treat your pet to a spa day? What are some activities you could safely do at home?
So, okay, spa days are fun. So dogs typically love baths. I mean, if they don't, then maybe take them to a professional so you're not putting yourself into danger. You mentioned you're a cat guy.
We take care of our neighbor's cat, kind of. So
yeah, I hesitate to give cats baths just in general. I just, they do a pretty good job cleaning themselves. So the baths are more aimed toward dogs. But if your cat likes baths, then go for it. With dogs and baths, the biggest thing I say to keep them safe is to avoid their head. So I only bathe from the neck down, avoid the ears, eyes. Soaps are dangerous if you get them in the eyes. The ears, actually, if you get water into the ears, it can cause an ear infection. Your ear canal is very dark and very long. And so if you get moisture down there, yeast likes to proliferate. So I just do neck back and just bathe them. So just avoiding the face. And then if you want to do nail trims, that's a fun little spa day. You can paint their nails, whatever they'll allow you to do. I have plenty of clients that come in with pretty pink nails, boys and girl dogs. They don't mind. They have no discretion on that. So that's a really fun thing. And then brushing is really nice, especially for cats. If you get your kitty used to brushing, I think that helps long term because a lot of my older kitties maybe have some arthritis, have some issues with getting back to their back end and can't groom as well. And so that leads them to get mats, which hurt. So I like to get cats used to brushing really early in their lives and they tend to like it. So it's going to help prevent any future issues too. So that's a nice spa day thing to add.
Before the next question, why did you want to become a veterinarian?
Ooh, I always liked pets. So a lot of vets say they wanted to do it from birth. I kind of wasn't like that. I had lots of different, all the crazy things that kids come up with. I've always liked pets and I like medicine. And so I kind of put them together and decided that was the way I wanted to go. And it's been an awesome choice. I mean, I get to play with puppies and kitties every day. Like, that's unreal to me. That's unbelievable that I get to do that as a job.
Okay, back to business here.
Yeah.
Okay, so for those listeners who want to trim their dog's nails and accidentally trim the quick, what can they do to stop the bleeding?
Yeah, so this I learned the hard way. So kind of, it's fun because veterinarians, I think, make every mistake that you've made at home. And now we get to kind of teach you how not to do it. So I did this with my parents' dog. I cut the nails and I cut them too short. And so the first thing I did was reach for flour. And actually flour is like your baking flour is really good at stopping the bleeding. So you just kind of pack it on there. Cornstarch works as well. So you just kind of pack it on there and just hold some pressure. If you don't have either of those things, just pressure over time will do it anyway. And then some people, if you have a male in the house that shaves and has those cautery sticks that they use on their face, those work really well. I do think they burn a little bit, so you just kind of have to use caution when you're using them. But the cautery sticks are really, really nice. So those are my kind of 3 go-tos. If you cut it so far back that they're bleeding and you can't get it to stop, just call your veterinarian. We can do bandaging and we have other things to stop that.
Can't use collodion products, over-the-counter products?
I've not. I don't know.
Okay.
I'd have to look into that for you.
Okay. Well,
yeah.
there's a common product in the first aid department in most drugstores, that has flexible collodion in it, and that does work quickly.
Maybe then I'll have to look into that and see.
Yeah, but I'm thinking that maybe it might be a little toxic. I don't know.
I'll have to look. Yeah, I don't know. I'd have to look into it for you. Right now, flour is my go-to.
Okay. All right. I'll have to remember that. That's okay. All right. So, are there any toys to avoid giving to the pets?
I don't really think there are any toys that we need to avoid, really. I will say it sounds like I have the worst dog in the world, and I kind of do. I mean, he's bad.
What kind of dog?
What's that?
What kind of dog? He's
a pug beagle mix. He's they call him puggles. I mean, they're challenging pets to own, and I like a challenge, so why not? So he gets into everything. He chews everything up. So if you have one like my boy, and you have like a really good chewer or somebody that rips through toys immediately, then I say you start looking for toys that they call indestructible, which I've learned nothing is indestructible. He can destroy everything in record time. But, I always monitor them. So any toy you give them, monitor them, watch them, make sure they're not tearing it up, because they can eat that then, and then you end up with me and a nice big surgery. So that's my biggest thing with toys. If they're getting the squeakers out, they can eat those as well. Usually I don't see choking as a hazard, but it can be. So just anytime you're giving a toy, just really, really monitor it.
So the next question was, what about dogs, pets that can get the squeakers out of the toys?
Yeah.
Is that noise and irritation to them, or why do they do that?
I don't know why they do. I just think it's just fun for them. I really don't know why they do it. I mean, maybe it's an irritation, which would be sad if we're giving them these things that drive them crazy. I just think they like a challenge, and I just think they like to tear it up and get to the inside of it. But those dogs, you really have to monitor them because they can swallow those squeakers too. So, yeah.
Okay. So do you have any recommendations about puzzle feeders?
I love puzzle feeders. A lot of us have animals that like to go and just gorge themselves on the food immediately. And so you kind of need to slow them down a little bit. So that's really good for slowing them down with eating. And it's also nice for brain health. So we want to stimulate them any way we can, especially these dogs or cats that are stuck inside all day, every day. You want to kind of stimulate their senses and stimulate their brain activity. So these puzzle feeders are really, really nice. There are a couple, there's one called a Kong Wobble, which is basically a feeder you put the food in and they have to smack it around and the food will come out in little pieces. There are ones shaped like mazes. My own dog has that one where he has to kind of get through the maze to get his food. There are other ones with humps in the middle. There are so many options. And if you don't want to go out and buy one because it gets pricey, you can just get muffin tins that you have in your cabinet anyway, and just spread the food out throughout the muffin tins, and they have to go to each little part of that. And so I think it's a really good thing for their stimulation and for them just kind of slow down, eat a little bit slower, so we don't have any, regurgitation or anything after the meal. But I love puzzle feeders. Yeah, I recommend it to everybody.
Okay.
All right. Well, before we get into vacation season questions, maybe it's time for the news.
Okay. Bottom of the hour, time for the news, and you're listening to Health Matters with the Medicine Center Pharmacy.
WHBC AM 10, reliable as ever on News Talk 1480 WHBC.
From the News Talk 1480 WHBC Newsroom, today is Earth Day, the largest civic observance in the world to raise awareness on crucial environmental issues. More than 1 billion people in 175 countries participate in events to commemorate the special day. The first Earth Day took place back in 1970. A 15-year-old boy has been arrested after police say he hit a police officer with a stolen car in Columbus earlier this week. They say he was driving the stolen vehicle when officers approached him. The teen drove towards police and hit the officer. That officer is okay. Now, juvenile court records show the teen was previously charged in at least 5 other cases involving stolen cars in the Columbus area in the past year. He was on probation for those at the time of the incident. New unemployment claims dropped to a 54-year low last week. That's according to new data from the U.S. Labor Department. Jobless claims fell to 184,000 in the week ending April 16th, the 10th time in 11 weeks that claims have dipped below 200,000. Economists say it is a sign that the U.S. has more job openings than workers looking to fill them. They also say it's a good sign for the economy. The Tennessee legislature has passed a bill that would require drunk drivers to pay child support if they kill a parent and are convicted of vehicular homicide due to intoxication. The legislation passed through the Tennessee Senate on Wednesday and is now headed to the governor there for his signature. The Cleveland Guardians are on a roll. They beat the White Sox yesterday 6-3. They are now in New York to take on the Yankees for a weekend series. Pregame tonight is at 6:35 right here on 1480 WHBC. I'm Pam Cook.
Your severe weather station, News Talk 1480 WHBC.
Here's your AccuWeather forecast. Sun and clouds continuing for the rest of the day. High this afternoon, 66, then becoming very cloudy tonight with a couple of showers and a low of 54. We'll have a warmer day Saturday with clouds and sunshine. High tomorrow, 82. Then partly sunny and very warm Sunday with temperatures approaching the record from 1925 with a high of 84. Rain and thunderstorms Monday. I'm Holly Holdren for News Talk 1480 WHBC.
Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off and Out By store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off and Out By store in Louisville, next to the Medicine Center Pharmacy.
Spring has sprung at Studio Arts and Glass. The hummingbirds will return, and Studio Arts and Glass has the feeders. Wind chimes, felt birdhouses, and garden art all make great gifts. Are you going to the beach? Then you need sea glass. Sterling silver and sea glass necklaces, earrings, and bracelets. Studio Arts and Glass open Monday through Saturday, 10 to 6 on Apple Grove and 77 in North Canton. StudioArtsandGlass.com.
When you list your tag sale with Genuine Estate Services, you will experience professional sorting, researching, staging, pricing, and marketing of your cherished possessions. They have a large staff hosting your sale also, and they are very efficient. Call Eric at 330-206-0974 or log on to Genure, spelled Jenior, estateservices.com for more information.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters. I'm your host and pharmacist, Paul White. This morning, Brad and I are talking with Dr. Mandy Pullekins, veterinarian with For Paws Animal Hospital. We have a lot more to cover this morning, so let's get back to the show.
Okay, well, hopefully with the hint of the weather this weekend, we're going to see some warmer temperatures soon, which is going to get us all thinking about going places, which I'm thinking means you're putting your dog in the car and heading out. So for pet owners that like traveling with their pets, what can you suggest to keep their pets safe and comfortable during that time?
Okay, so these recommendations are mostly for domestic travel. So if you're doing something international, you got to be thinking way in advance and talk to your veterinarian way in advance, because they're different. That's a totally different situation, and there are a lot of different things you have to follow for that. So domestically, if you're traveling with your dog, if your dog's getting in your car with you, I love seat belts for dogs. So a lot of us like to have them riding up front and, just kind of hanging their head out the window and that kind of thing, which is cute and wonderful. But I like to have a seat belt. I've seen unfortunate things where dogs have been thrown from vehicles. So I think that's going to be your best bet, is to be safe with a seatbelt. There are lots on the market, and they're pretty comfortable. A lot of them have like nice little pillows and stuff with them. So they're really nice for your pets. I don't love dogs with their heads hanging out the window. That exposes them to the elements and it exposes them to debris. So you can get something stuck in your eye. You can get hit with something, or if your dog is kind of crazy like mine, you can jump out the window. And so we never want anything like that. And certainly nobody deserves to be in the back of the truck. So keep them in the cab with you. If you're taking your kitty, if you're adventurous and taking your kitty on the road with you, just make sure we're in a nice carrier with something comfy. And talk to your vet if you're concerned at all, because we have lots of options medically and behaviorally that we can help you with.
Okay, so we had a question in the pharmacy last week from someone who wondered if pets can get sick in the car, like car sick, like humans can. So do you see that?
Yes, we see it all the time. All the time. A lot of sickness in animals in the car is related to anxiety. So sometimes all it takes is just some simple counter conditioning, getting your dog used to the car, getting them in the car more, kind of taking them to the car for not maybe for a long ride, just something a little shorter, just get them used to it. But they get motion sickness too, just like we do. So if you have a dog that's getting in the car and has nausea or vomiting or is drooling a lot, that's a real big sign. Then there are options. They're prescriptions typically. So there's one called Serenia, which was made specifically for dogs with motion sickness. And it is life-changing for people that have animals that can't go on car rides. So definitely something to talk to your vet about, because we can really help with that.
Very good. Okay,
yeah.
Great.
Yeah.
So I know ear infections are very common that you see in your practice. How about some tips for patients or for pet owners that have recurrent ear infections in their pets?
Yeah. So I see ear infections every day. Right now in the spring, I'm seeing them. I mean, I'm seeing 5, 6 a day. So they're super common. And what we don't realize is, yes, you can get the rogue ear infection that's related to bathing and getting water in the ears or swimming or something like that. But most of these are related to allergies. So when we get allergies, we get runny nose, runny eyes, or sore throat, that kind of thing. When dogs get allergies, they tend to get skin issues. So their body responds by getting really inflamed skin, and ears are a big, big part of that. And so then when you have that inflamed skin, it makes you a little bit more prone to an infection. So the biggest thing you can do is talk to your vet about why we're getting these recurrent infections and get the underlying allergy under control before we start treating that secondary infection, because that's going to be our main culprit. And I always tell owners with these recurrent ear infections that my goal is not to never have an ear infection again, because most of these recurrent ones, that's not going to be the case. Usually they're going to have another one, but my goal is for you not to see me every month. So my goal is to extend the time between these infections. And so typically get that underlying allergy under control with medications or, immunotherapy or something else. And then we work on a regimen for the ears themselves. And sometimes that includes cleaning them more frequently with a vet-approved cleaner. Sometimes that includes maintenance therapy. It just kind of depends on the pet and the type of dog. Cocker Spaniels are way more common with them. So, it's just going to depend on your dog in general. Yeah.
What's your favorite treatment option for ear infections? Do you do it in the office, or do you send people home with something, or?
It depends. If they're more if it's not so chronic, I like to send owners home with things. My chronic ear infections, I tend to like to give them a really nice deep clean in the office. And then there are a couple products. There are OD packs that I can put in that last for a couple weeks. Usually they have an antibiotic, an antifungal, a steroid in them. There's a new product on the market called Claro, which works for 4 weeks. So there are a few that I really like, because dogs with ear infections are super sensitive with their ears. They hurt. And so sending home a medication for somebody to be using twice a day, every single day, on a dog that hurts is not really ideal. I mean, I wouldn't want somebody messing with my ears every day if it hurt. So sometimes it's better for me to just put something in there and then do a recheck in a few weeks and see how we're improving.
Well, that makes me think of cats, because they can be particularly hard to give something orally. What's your favorite treatment methods for cats?
Yes, so cats are very challenging to give things orally. If you're really determined, I can teach you how to give a pill to a cat. And I have I have products that can help give a pill to a cat. And some cats are really great with it. There are a few. But for the most part, I'm reaching for liquid medications, so suspensions. And then compounding pharmacies now have a lot of and you probably know a lot about this, but they have a lot of medications that are transdermal. So something that they formulated that absorbs through the skin, and usually you just rub it on their ear once a day. They are amazing for cats, because it's way easier to rub something on your cat's ear as they hiss and run away versus trying to hold them down and get something in their mouth. It's very challenging. But yeah, my transdermal, and that's something you talk to your vet about, because not every medication can be available that way.
Right.
And maybe there might be a different cost associated with it, but it's something to talk to them about, because it's readily out there and it's an option for a lot of medications.
I think the nice thing about those transdermals too, for cats in particular, is it can almost be kind of a soothing application of therapy, because it's like you're petting them. It's not like you're take this medication.
Exactly. And I tell everybody, one of the biggest things with me is I'm trying to help your animal, and I'm trying to help you too. And I don't want to hurt that bond between you and your animal. So it does hurt your bond when you're trying to shove something down their throat every day and they don't want to be near you and they're running away and they're hiding. So yeah, you're right. I mean, rubbing something on their ear is going to be a way better experience for everybody, and you're going to keep that bond up. while you're treating them medically. So I think that's super, super important for kitties. Yeah.
Wow. Okay. This is an interesting question. What are the signs that my dog could use a little less attention?
Oh, I love that. I actually love that question. Because, we're so used to running up and hugging our dogs and getting in their face, and you see a dog with a wagging tail and you want to run over and touch it. And sometimes that's not what we should be doing. So wagging tail just means that they want some kind of attention. It doesn't mean good or bad. Clearly the dog that's waggling its whole butt and really getting into it, that dog probably wants to see you and probably wants some attention. But sometimes they're wagging their tail maybe a little more tentatively. That might mean that they're a little bit nervous. Dogs are really, we really know the signs when they're growling or when they're shying away from you. That's easy to tell. But sometimes it's something subtle, like I'm licking my lips a little bit more, or I'm yawning. That doesn't just mean you're tired. That can mean you're getting a little bit anxious. Ears going back a little bit. They're kind of subtle signs that maybe you need to kind of lay off a little bit. Maybe we're showing you something that we're uncomfortable, that maybe it might be preceding a bite or something. So those are signs that I have 6-year-old twins. So I teach my kids, if a dog's doing that, don't hug them, kind of just let them have their space and just make sure we're being safe around them.
And cats, same thing?
Similar. So cats, we associate that tail wag with happiness all the time, right? If a cat comes into me and they're wagging their tail, I am immediately going to be a little bit nervous, because cats that wag their tail are not happy cats. So tail flicking in a cat means they're unhappy. They will put their ears back a little bit. They'll start to grimace their face. They show you way more subtle signs than dogs that they're unhappy. And usually if a cat's unhappy, they're going to act on it. So just kind of lay off. Lay off of the kitty if she's showing you that sign. If they're wagging their tail, just let them be. Let them be.
Okay.
Yeah.
All right. I think our final break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
Saving money is awesome. Saving money on items you actually use? Fantastic. Hi, Paul White for the Half Off on Hot Buy store in Louisville. If you think you'll find the same low prices, huge variety, or great customer service at any other store, you'd be wrong. Stop into our store in Louisville and see what great deals we have. Follow us on our Facebook page at Half Off Store to see super specials. Why pay full price? Come in and experience the Half Off on Hot Buy store in Louisville, next to the Medicine Center Pharmacy. When you list your tag sale with Genuine Estate Services, you will experience professional sorting, researching, staging, pricing, and marketing of your cherished possessions. They have a large staff hosting your sale also, and they are very efficient. Call Eric at 330-206-0974 or log on to Genior, spelled Jenior, estateservices.com for more information. Hi, Paul White from the Medicine Center Pharmacy. In these difficult days, please stay calm and make sure your medical and healthcare supplies are well stocked. Make sure you have Kleenex, acetaminophen or Tylenol, ibuprofen or Advil, Mucinex, Robitussin or Dayquil, cough drops, maybe even a humidifier or a vaporizer. You can also just turn the shower on hot and sit in the bathroom breathing in the steam. How about vitamin D and a probiotic? So take care of yourselves and don't stress about the coronavirus. Make sure you get plenty of rest and plenty of healthy food. The Medicine Center Pharmacy, Canton, Louisville, Minerva, and New Philadelphia. Hi, Paul White from the Medicine Center Pharmacy. If you haven't gotten your COVID vaccine shot yet, you've got to get to the Medicine Center Pharmacies in Canton, Louisville, Minerva, or New Philadelphia. We are waiting for you and have vaccine. Call or stop in your closest Medicine Center Pharmacy, and we'll take care of you. Getting a COVID vaccine will save you from getting very sick. So hurry and get on with protecting yourself. The Medicine Center Pharmacies in Canton, Louisville, Minerva, and New Philadelphia.
You're listening to News Talk 1480 WHBC and Health Matters with the Medicine Center Pharmacy. Now, here's your host, Paul White.
Welcome back to Health Matters. This morning we are talking with Dr. Mandy Pullekins, veterinarian with For Paws Animal Hospital. I'd like to mention also that January Appraisals and Liquidation is having a tag sale this weekend at 3111 Westmoreland Avenue, Avondale. Check it out.
All right. We talked about travel a little bit earlier in the program, and sometimes maybe you can't always take your pet with you, but you might need to consider a kennel. So, Dr. Pullekins, what can you offer owners to have the best practice for maybe getting their pet conditioned for a kennel and to stay there?
So the biggest thing with kennels is, we have a lot of talk about vaccines going on recently over the past couple of years, but make sure you get into your vet and get all their vaccines updated. It's really, really important for them that they don't contract any diseases while they're there. Or at least if they do, that they're going to be kind of tamed down diseases. So definitely talk to your vet about getting vaccines updated. And then a lot of owners are anxious about the kennel in general. Go visit them. The kennel that I take my dogs to, I talk to them about all my concerns. They let me see the back. They let me see where my dogs are going to be. And most kennels are pretty good about that. So talk to them beforehand. And then make sure that they have a relationship with a veterinarian as well. Most of the kennels around my area will call me if one of my pets is sick, and we can take care of it from there. So definitely talk to them if you're concerned at all. And because I have bad dogs, I have a long laundry list that they get to hear from me, and they know it every time. So they're prepared.
Your dogs should be super. You're a veterinarian. Your dog should be.
You would think so, right? No. Marley and me has nothing on my dogs.
All right.
I guess I'm kind of thinking maybe your pets are slated for having their own social media page for what did I do today?
That's quite, yeah. I have 2 dogs, 2 cats, and 2 kids. I'm running a circus. I could definitely have a really good.
Oh, I love it. All right. So how about people that love to give their pets kisses, but their breath might be pretty bad? What tips can you give for not only hygiene, but maybe good oral health tips for pets?
Yeah. So oral health is super important for pets. So we think it's very important for us as well. So it makes sense that it'd be important for pets and for their overall health. So the biggest thing is if you can condition them to brushing their teeth early in life, that's going to be the best thing. And that's a daily thing. So that's not just a once every month when they get groomed kind of thing. That's daily. So if you have a puppy, start feeling around in their mouth and you can go to your vet, or you can even go to a pet store and get a toothbrush. There are brushes that go on your finger almost like a thimble. And you can get dog specific or cat specific toothpaste and get them used to it. For those dogs where we've kind of missed the boat on that, and that's not going to happen because there are plenty of animals like that. You talk to your veterinarian about doing a dental cleaning. We do it under anesthesia. We scale and polish just like you would get done at your dentist. And it really improves their quality of life. And I don't know how many owners have told me after we've done dental cleanings and maybe extracted a few bad teeth that their pet's acting like a puppy or their cat's acting like a kitten again. And they didn't even know that they were sick. They didn't even realize that they had any issues. But, now this pet feels so much better. So it's really beneficial to them. And I think about it, if I have a toothache, it hurts, so they have the same feelings. They have the same stuff going on. So it really helps them to get their dental health taken care of. And it makes those kisses more tolerable. I'm not going to lie.
Gosh.
All right. Well, living in Ohio, we'd be remiss if we didn't talk about the escalating tick problem we have. So what tips for both care and treatment and maybe just awareness can you share with our listeners today?
Yeah. So I see so many ticks right now. And with ticks, unfortunately, we're seeing an uptick in, no pun intended, in Lyme disease, which I think we're seeing on the human side as well, but I'm definitely seeing a lot in pets. And so so we're seeing lots and lots and lots of ticks. But the good thing is with animals, we have a lot of really good tick preventions on the market. And there's kind of any formulation you would want. There's topicals that you can put on the back of their neck. There are collars that you can use that you have to. The big thing with collars is you have to make sure you put them on appropriately. So that's something that you may want to talk to your vet about, that it's on appropriately to work. And there are orals on the market too. There are orals that last for 12 weeks on the market. So there are so many options that we can do that do really, really good job with tick prevention, that I think everybody needs to be on it, and they need to be on it all year long. It's just a really big concern here.
I have some friends who have deer visiting their backyard. Okay.
Mm-hmm.
And of course they are feeding them. Okay.
Yeah.
And then their cats and once in a while their doggies go out and kind of mingle with these animals. Okay. What should we do here?
Oh, I would try to avoid that. Deer can be, I mean, they're not typically aggressive creatures in general, but they could be. And so I would try to avoid that. But if you're thinking specifically because of deer ticks, we would be doing the topicals as well.
Would they, okay, Lyme disease, ticks, deer, do they like all sorts of animals?
Yeah. Kitties, I think, are way less prone to Lyme disease. I don't think I've ever even had a cat with Lyme disease. But ticks love all sorts of animals and humans, unfortunately. So they're not very host specific on that.
Gotcha.
Yeah. Yeah. But yeah, it's really common that everybody's feeding the deer around here. My parents have the fattest deer in the land, I think, because we've been feeding them. So,
pizza pie, eh?
Yes. Yes.
Leftover pizza.
Yeah.
Okay. I love it.
All right. Well, we are kind of running close on time. So I guess I want to maybe what we ought to do, we've got about maybe 4 minutes left.
Okay.
So, we threw a lot of questions at you before the show. Is there any really important takeaway you want to leave with listeners before we run out of time today? And we want to make sure that we give your contact info and, how listeners can get in touch with your practice for additional help if they need it with their pets.
Yeah. So, the big takeaway is just love your pets, and we love them just like you do. So when I know everybody was on curbside, it was a really different experience over the past couple of years. And if your vet's still on curbside, it's the dogs and everything are okay. I kind of want to let everybody know that we're playing with them inside. It's actually very fun in there. So, yeah, make sure they're on flea and heartworm prevention, and tick prevention this summer is a big, big thing. But yeah, that's kind of the big takeaway. You can get a hold of us. forpawscanton.com is our clinic's number. You can find us on Facebook as well, For Paws Animal Hospital. And our phone number is 330-494-0611. That's probably the number one way to get a hold of us is by calling the office. And we're there. We're there whenever you need us.
So is heartworm a big thing still in this area?
It is. It's. I would say we're moderate risk. I mean, certainly you go down south, it's way worse. But yeah, we do see heartworm disease, and we do treat heartworm disease. So it's really important to be on heartworm prevention every month. Really important.
Dogs only, or cats, or
cats can get it too. It's way less common in cats, and I think most cats are indoor, so that's a big player in that. But there are heartworm preventions for cats too, definitely. So it's something that we need to be concerned with. Yeah.
Well, I guess we're just about out of time, eh, Brad?
Okay. Yeah, I think I can sneak one more quick question in. All the things we talked about today, how often should people bring their dog or cat to see you? Once a year, twice a year? What's a recommended
once a year?
Schedule?
Yeah, once a year is recommended. For my senior pets, I like to see them twice a year. Things happen really, really fast in my seniors. So if your dog or cat's getting 7 and older, come see me twice a year. And then we can just make sure we avoid anything in the future.
Okay.
Super. Yeah.
We had a great show, Dr.
Yeah,
Mandy
thank you for
Pullekins.
having me.
Very, very, very pleased and very enjoyable. Thank you so much.
Thank you. Yeah, thank you.
Dr. Mandy Pullekins, DVM with For Paws Animal Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to our sponsor, Studio Arts and Glass, Genuine Appraisals and Liquidations, and always We thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy week, and we'll see you right here again next Friday, right on News Talk 1480 WHBC. Thank you, Doctor, very much.
Thank you. Thank you.
Have a good day.
The preceding program is sponsored by the Medicine Center Pharmacy.
Hey, there he is. How's it going?
I'm having a stroke.
Are you going to shake my hand or what?
I'm having a stroke.
Wow, you're not even moving your arm.
I'm having